long-term risks from polycystic ovarian. As I said, it is a metabolic disorder. It's a metabolic, and its genesis is a metabolic disorder. And the one thing that we do know with women with polycystic ovarian syndrome is they have a much, especially for those women who have a raised BMI, and that's a BMI over 26, they do have a much higher risk. I believe people have quoted 50 to 60% risk of developing type 2 diabetes in later life. We're talking about when they're over 50. So that is one of the big risk factors of polycystic ovarian syndrome, that there is a higher preponderance of them developing type 2 diabetes, which is the non-insulin dependent diabetes mellitus. Um, the other risk factors with polycystic ovarian syndrome, especially for women who have irregular or absent periods, is that they also run the risk of developing endometrial cancer or endometrial hyperplasia, which can lead to endometrial cancer because they're not regularly shedding off the lining of the womb. And so, if a doctor notices that a woman who's not necessarily trying to get pregnant, but she's having very infrequent periods, they would normally start her either on the contraceptive pill or even give her progesterone tablets to induce a period at least 3 times a year. Uh, we also know that women with polycystic, and again, this is really associated with those with raised BMI, have a higher risk of developing cardiovascular disease later on in life. And so, and all of these have a metabolic genesis. But again, lifestyle changes can reduce almost all the things I'm talking about, which is the endometrial hyperplasia. If you lose weight, you're less likely to get a thickened endometrium. You're more likely to have regular periods, and therefore your risk of endometrial cancer is reduced. Um, um, developing type 2 diabetes, if you lose weight, exercise, and dieting, again, you're less likely to develop type 2 diabetes in later life, and also reduce your risk of cardiovascular disease.